Hacey's Health Initiative works in Nigeria, Lagos, Nigeria, though we work in some other states in Nigeria too. And basically what we do is to help children and women to create a healthy and sustainable society through capacity building programs, advocacy, research, and education. We help them understand the linkages between health and climate change, and also carry out research among health professionals, health workers, on helping them to understand the linkages also between health and climate change. So basically our work involves capacity building, as I said, advocacy, research, and education, the CARE approach, C-A-R-E.
Right. I mean, more specifically, the link between health and climate change. I mean, what kind of projects are you working on? What are the issues that people in Lagos are suffering as a result of climate change, the health issues they suffer as a result of climate change?
For example, earlier this year, we experienced the flooding in Lagos, one of the highest form of flood in even Nigeria history. It was so much, though the NIMED has warned about the flood. And this actually comes with a lot of things such as malaria, diarrhea, and so many other things. These issues affect children so much. They affect women so much, because mothers of children under 5 years old are really affected by malaria, especially in Lagos, Nigeria, that is bordered by the Atlantic. And having so many health workers also in Lagos, Nigeria, who doesn't even know about the linkages. So we organize capacity building programs for these health workers, and even carry out research to know the level of understanding of doctors, nurses, and traditional health workers, their knowledge about climate change and how they understand the linkages. And it's striking to know that most of them don't actually know that climate change really affects health. And some of those who know, they can't even establish the relationship. So it's definitely very important for us to establish these linkages through capacity building and research, basically.
Right. And what kind of things can be done to lessen the impact, the health impact of flooding, for instance, in an area like Nigeria? So what kind of measures do you recommend?
Basically the measures that can be taken across different sectors, not only the health sector, the urban planning segment, the Ministry of Environment, Ministry of Health, also definitely need to work together on education first of all, so that people will know how to take care of their environment, what they need to do. Also, health workers need to be empowered, to be educated. For example, climate change education needs to be incorporated into medical programs at all levels, and that's what we are advocating for, because health workers need to understand this. This is part of those things that can be done from the angle of the Ministry of Health. And also the Ministry of Health needs to incorporate the public health and environment framework for climate change, with the WHO recently launched, into their programs, so that it can get down to the grassroots level, and community health workers, traditional health workers can possibly understand these terms in their own traditional languages. So it cuts across different sectors: the education, the research, capacity building, and advocacy.
Okay, that's great. Thank you very much. And can you talk about a specific, just to kind of take it away from the theoretical in a way, and talk about a specific program that you've worked on, that the Health Initiative has worked on? Tell me about how you arrived there and what kind of work you've done since you arrived.
All right. One important thing we do is that when we design our programs, we lay emphasis on capacity development, because we understand that we won't always be in the environment. So we empower the society at large, we empower the individuals in such a way that they can continue to sustain the project. For instance, there's a project we do in Lagos State in Nigeria, in a part called Bariga, where they are very close to water. They have so much of pollution around, so much of the environment, environmental issue. So on a particular day set aside by the government in Nigeria for sanitation, we go there in person. We join their women, we join their market women, we join their community leaders, we provide equipment for them. And together with them, we clean the environment. We show them what the environment can look like when it is clean. And beyond that, after we have cleaned the environment, we now help them realize how that environment links to their health, because that's the country where, is a part of the country where most people does not know that the environment actually impacts on their health. They suffer from a lot of malaria, and when they go to the hospital, at times the doctors don't know where they are coming from, so they just treat them and return them back to where they will go back again. So that's one practical example. Another practical example is in Ebonyi State in Nigeria, where we went to the school, children's school, because we work actively on children, and we helped them to realize the importance of having a very clean environment. We provided dustbins. We taught their teachers on how to teach them to step down the training of keeping the environment very clean. for them. And beyond that, we helped them. We did the work. We went there in our working suit and we did the work. We showed them what it is to be done. So by doing that, we build the capacity of individuals on how to clean themselves, their environment, their immediate family, and we build community capacity, which we believe will give such projects sustainability in the future.
I mean, do you find generally that people are very receptive when you go into these communities which are suffering the effects of climate change? Do you find they're very receptive to your ideas, or do you need to sometimes convince them, look, this needs to be done to improve your quality of life?
Yeah, one thing we should consider is in the kind of country where there are so many different social backgrounds. You know, for instance, going to a place like Lagos wasn't difficult because we are part of them, we lived there, so it was easy relating with them. There was no religious barrier, which can't be the situation in some other part like the northern part of Nigeria. So they received us, and showing them the link between their health and their environment was very good for them because most of them were here. But after one or two of such practice of environmental sanitation, they saw the effects. They saw how the environment could be. They appreciated it, and they wanted us to come more and more. We distributed mosquito net and so on. But in another part of Nigeria where there may be a little barrier, religious barrier, it was hard a bit because they necessarily didn't know who we are, even though we went through the right community sensitization, but they are very, they don't easily accept people. So it took us a while to explain to them what it is. It took us a while to make them see the good in it. And then the moment they realized the good in it, they came out, they supported us, and we did the work together. So it is, in some part they accepted us, without so much stress, but in some other part we had to, explain ourselves, meet with their community leaders, advocate, and before they get what we do.
Okay, that's great. Thank you both very much.